very closely with the organizations that actually manage the senior centers on our behalf. Many of our senior centers have a board of directors approach, and we've been working with those seniors to say, when is it that you feel safe and you feel is the right time to come back for some programming? And at Sackville, they feel that time is now. And so we're excited to see some of that happening, and more programming at our other senior centers will begin as we move forward. So as I say, lots of things happening in recreation. Best to go online and see what's happening. Things like the Quad Pad and the Mountain Arena Skating Center now open as well. Indoor dining at our golf courses is of course now available and has reopened. And our free fitness in the park is resuming today as well. So we've got lots of things going on for the remainder of the summer as the province and therefore the city of Hamilton move through some of these reopenings. From a special event perspective, we are looking at issuing permits for events with dates after August the 1st. So you're going to start to, we would imagine, see some more and more community events happening as the summer moves on and we enter into the fall. And just a reminder that we will try and process applications as fast as possible. And small community events can now just proceed as long as they don't require anything from the city. You can proceed as long as you follow the provincial gathering restrictions. And really that's the goal for everybody, is to be safe, to make sure that you follow the restrictions that are in place and you know those restrictions. We still will be enforcing to the regulations that are there provincially. And I'm pleased to know that the previous week, there were no provincial offenses issued. No new businesses added to our website in terms of those who have breached things under the Reopening Act and the restrictions that are in place. And so that's good news. There were also no physical distancing or face covering penalties issued. And so we're doing a lot with making sure that we educate in terms of restaurants and other amenities who are getting back up and going. Could be gyms. We're in that phase of educating people because it's been a long time since we've seen some of these activities, and making sure they're following the rules. But it's good to see that people by and large are following the regulations that are there. And as I say, for all of us as we go about our business in this community, please just be respectful of the instructions that staff provide when you go to these areas. Don't debate with them. If they have regulations that they need to follow, just comply. That way we can all enjoy these amenities. We can all get back to the things we like to do and enjoy them well. There were lots of fences issued in terms of our falls areas and some of our parks areas. And just a reminder to the community that COVID-19 or not, please respect the signage and the restrictions that are in place, particularly at our waterfall areas. As many people have seen in the media, we have had to initiate several rescues in our falls areas. Those are obviously, it means people are injured themselves in our falls area. And so for the people injured, it's a very traumatic time, but it's also a very dangerous time for our responders. Our fire department is well trained at high angle rope rescue, but having seen that crew in operation and understanding the work that they do, this is a very dangerous situation that we put our firefighters in and our other first responders who are there from a medical or police perspective. And so please enjoy our outdoor amenities. We're blessed with just some great places to get outdoors, but let's do it safely. And that will mean that we hand out less charges. It'll also mean everybody can keep safe. So again, it's great to be back to doing many of the things we like to do, and we're looking forward to even more activities as the summer progresses, and looking to some of our larger sports events starting back up. I know the Hamilton Honey Badgers have begun with some fans at their games, and then the Forge and the Hamilton Tiger Cats as professional leagues will also be welcoming people back to Tim Hortons Field as we move through the summer. And so it's nice to see these things happening, but it is still a reminder when you look at all the restrictions that will be in place. It's still a reminder that we are not through this pandemic. It is not over. The cases are not down to zero, as you'll hear from Dr. Richardson in just a moment. We still have cases of COVID-19 on a regular basis, and we're still concerned about the variants of concern, including the Delta variant that is driving some of those cases in our community. And the last piece, of course, is alongside all the great activity that is happening in this community, if you have not yet received your first dose of vaccine, please consider that. Talk to your healthcare provider if you're having some questions about whether you should. Make sure you get for that first dose, and then as quickly as possible get to that second dose. And if you are waiting for your second dose and you can advance that appointment, please do so. And Dr. Richardson will explain all the really easy ways, now that we've got a great supply of vaccine, that you can get that first or second dose as quickly as possible. That's the other way that we're going to keep things moving forward as we see fit here. So with that, I'll turn things over to Dr. Richardson, and then we'll be on to our media questions for today.
Thanks very much, Paul. Yes, indeed, our case activity does continue to be low. We're at 21,558 cases so far, but just a net change of 31 cases from Friday, July 23rd. Our local activity continues to mirror that was seen in late September and early October of 2020, and it continues to be low amongst all age groups. Our average number of new hospitalizations is low. The average number of deaths per day are low as well. So as of today, our 7-day moving average of cases reported per day is 13. The weekly incidence per 100,000 is 15, and our weekly reproductive number this week is 1.22. So you may notice a fair degree of swing in that number, and that is because the number of cases are so low, so the estimates do change significantly with any cases that do occur. There are just 3 active outbreaks today and no new ones that have happened over the last 24 hours. Our percent positivity continues to trend downwards. We're right now at 1.68%. We're still sitting at 5th in the province. We've come down amongst our fellow public health units, according to the ICES data, and of course, we'd like to see that go down even further. In terms of the vaccine rollout, of course, we had a number of significant announcements last week amongst our local vaccine program and how it's going to transition over the coming weeks. As of today, the Hamilton Healthcare Partners have administered 715,285 COVID-19 vaccines locally, and an estimated 76.6% of Hamiltonians 18 and over, with an estimated 65.8% of youth 12 to 17 years of age having received at least their first dose. In addition, 64.4% of adults and 43.2% of youth have received second doses to date, so that is good news. But it does also mean that there are many community members who have yet to receive their first dose of the vaccine. And of course, we've also known and are concerned about the fact that protection isn't equally distributed across the community. The vaccination campaign does continue to evolve, and it's been transitioning now to clinics across our community, including over 100 pharmacies here in Hamilton that are providing the vaccine. There are targeted mobile pop-up clinics, of course, out there. 2 primary care-led clinics, one at David Braley Health Sciences Center downtown, and the other in the East End at Winterberry Family Medicine. We have begun the process of a very careful and measured wind down of the 3 large-scale mass vaccination clinics, and as well as Hamilton's employer-led clinic at ArcelorMittal Dofasco at the center on Barton. So with these in mind, I do want to take a moment now to acknowledge all of the partners across the city who have played instrumental roles in getting us to where we are today. Our healthcare partners at St. Joseph's Healthcare Hamilton, Hamilton Health Sciences, Hamilton Paramedics, Primary Care, Public Health Services, and other redeployed staff from across the city have been keeping the mass clinic sites and mobile pop-up clinics running smoothly, providing caring and considerate care for our community members who are 12 and over to receive their COVID-19 vaccines. I also want to talk about our sincerest gratitude that goes out to our local pharmacy partners and community organizations such as Refuge, Des Doigts de Desnay, and others who have been operating the targeted vaccine clinics, along with the leadership from ArcelorMittal Dofasco, who have both funded and run Hamilton's only employer-led clinic, and of course, opening that clinic up to the broader community. Our vaccine program, of course, within this pandemic continues to provide historic levels of service, has been an absolutely significant and huge undertaking, and could not at all have been done without the collective efforts of the whole being much greater than the sum of any one of its parts. Now, by no means take this round of thank yous as a signal that our collective job is done. Next month, you're going to see a continued push around increasing vaccination rates across all areas of our community throughout the whole healthcare partnership so that we can have the highest level of protection against COVID-19 that we possibly can as we head into the 2021-22 school year. And of course, back, I hate to say it, but back towards fall and winter. So echoing Dr. Moore, the Chief Medical Officer of Health's appeal to the people of Ontario, consider this Hamilton's call to arms. Our vaccine supply is abundant. As Paul said, there are numerous locations throughout the community to get a COVID-19 vaccine, either through a walk-in or a booked appointment. So you can do it in whichever way suits you best. And those walk-ins can be for first doses or second doses at any of the city-run sites or any of the large-scale clinics. So it's never been more convenient than it is today to get those vaccines. As Paul mentioned, it's really important to get those quickly as we head towards the fall and people going back to school, whether it's in middle school, high school, college, university, whatever it may be, a teacher, a student, all of those, the staff that play such a critical role in all of these institutions. The last day to get vaccinated to have 2 weeks before you start back into the schools is July 27th for a first dose and August 24th for a second dose. Now, even if you miss that deadline by a day or two, just keep coming on out to get vaccinated, because being vaccinated when you're working and being in those settings is one of the absolutely crucial elements to controlling the spread of COVID-19 in our community. The province has also made it clear, of course, that to move into step 3 of the roadmap is going to require at least 21 days and having the percent coverage of those who are eligible at 80% of the population over 12 and over. And as well, they want to see 75% must have received their second shot and no public health unit having less than 70% of their population fully vaccinated. So as you can see with our numbers, we do have a bit of a ways to go yet in getting those vaccination rates up. We definitely want to see those continue to climb. We want to see them continue to climb so that you're well protected, to protect those you love, and so you can get back to the things you love, just as Paul's been talking about, whether it's going into recreation programs or it's going out to do other things. It's really important to get that coverage in place. Of course, you can find out everything about our vaccine clinics, our operating hours at hamilton.ca/getyourvaccine. It is updated regularly with the most up-to-date information. So do check in if you're planning to go. You can find our latest clinics that are throughout the community listed there. You can also find links to the pharmacy locations that are providing vaccinations as well. Of course, if you are somebody who's had a second shot and an appointment for a second shot that follows on from the time of our wind down of our clinics, we are going through a process of notifying those who are part of that, but please do be proactive. Call in to rebook those doses earlier on. We'd really like to see everybody vaccinated within 28 days, by that 28-day mark after their first vaccination. So please do call through to the provincial hotline or go onto the website and rebook those appointments. So that's it from me. Jasmine, I'm going to turn it over to you to go through with our media partners.
Great. Thank you, Dr. Richardson and Paul. So we have 5 media joining us for the briefing today. As usual, we will start with 1 question and 1 follow-up for everyone. So the first question goes to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. This would be for Dr. Richardson. In terms of reaching the neighborhoods, because there are still neighborhoods in the lower city that are really lagging behind the rest of the city in terms of getting their first and second doses. I know the public health has said they're doing vaccine ambassador outreach to try and reach those populations who still aren't, they're hesitant or for whatever reason. How effective have those actually been? And are you optimistic that we're going to reach the targets that are set in place?
Thanks very much, Lisa. We've set the target locally of ensuring that all of the parts of our community get that higher and that 75% level of coverage. And that's what we'll continue to work at. And we're definitely following things that have been shown to make a difference in bringing up rates for what we would call evidence-based measures to do that. We know that speaking with people who are trusted members of the community that one comes from is a really important piece of that. Having different leaders who are from all of those communities speaking to the issues is part of it. And so there's a comprehensive program beyond just the ambassadors who are doing fantastic work, reaching out, whether it's in apartment buildings or to neighborhood groups or being in the park that people tend to go to after dinner hour. Those sorts of things are out there. We're also working with faith-based leaders to ensure that they have the information to encourage vaccination. Our Hamilton Healthcare partners are doing multiple things. Our primary care docs are going to be reaching out to patients from their clinics to talk to the ones that haven't been vaccinated, ask if there's information that they need, ask if they're aware of where those vaccines can be found. As well, across the whole system as well, we're using an approach of asking people who come in about their vaccination status. And again, working through, do you have any questions about it? Do you need some information? Are you aware of where you can get vaccinated? Do you need some help? Either booking in because that's more convenient to you, or understanding that your children are welcome within our vaccination clinics. If you've got your kids and not quite sure you want to bring them down to the vaccine clinic, don't you worry. All of our clinics are quite well versed in helping to manage that, manage those issues and help move through it. There are doctors and nurses that are present in our clinics and can speak to any questions that you might have around the vaccine. So it's a whole comprehensive approach that's going on across the city around getting those vaccination efforts up. We do know that the last crucial ingredient is time and commitment. And as you'll see across all of our groups, across all of our FSAs, those rates do continue to rise for both first and second doses. And that commitment of being there day after day, so people trust the people that are there to provide those vaccines, and whether that's through Refuge, whether that's through Des Doigts de Desnay, whether that's through ourselves in those sites, and our ministry partners that have been out regularly, that's really important in order to build that trust with our community and get those rates up.
Okay, thanks. And my second question is really more of a technical one. In terms of the city's website, I know the cases information is not currently on there. I'm just wondering, in terms the active outbreaks that are currently listed, what are those?
Let me just see if I don't think I have them here, Lisa. Let's, between Ashley and I, who's on, we will get back to you on that piece.
Great, thank you. We'll go next to Desmond from CBC Hamilton. Desmond, you can go ahead.
Thank you. And I think Lisa basically asked my first question. Dr. Richardson, you had mentioned there are many community members yet to receive their first dose of the vaccine. I really wanted to ask you what more would you say could be done to encourage people to roll up their sleeves?
Thanks, Desmond. I think I pretty much covered it fairly comprehensively with the answer to Lisa's question. We're working on many different fronts with many community organizations, whether it's Hamilton Center for Civic Inclusion or it's Refuge, Des Doigts de Desnay, our Faith Leaders Group, many different organizations, ourselves, primary care, all of our healthcare institutions across the city are looking to at ways that we can help to make vaccine available, information available, talk with people, help them understand their particular circumstances, make it comfortable to get vaccinated, have easy access to it, making sure that people have all the information that they have. So a whole host of different measures being taken.
Thank you for that. I also wanted to ask, can you share any information as it relates to vaccination among workers in long-term care homes?
We don't actually collect that information, Desmond. The long-term care homes themselves would have that information. They do. They are operating under a policy from the provincial government where they're collecting that information from their staff, but they don't at this point report it to us.
Great, thank you, Dr. Richardson. Our next question is to Emily Taylor from CHCH. Emily, you can go ahead.
Hi, Dr. Richardson. I hope you're doing well. I was just wondering, we're about 10 days into this phase 3 now. We're looking at around 11 more days or so to hit that 21-day mark. Are we on track currently to hit that 75%? If not, how far away are we?
Thanks very much, Emily. I think it's, it's close. We certainly have enough vaccine in terms of availability. We have plenty of supply, plenty of different places, as you've heard me say, where that vaccine can be obtained. I think we are going to continue to see a slow rise, and it's a matter of, do we make that within the 21 days, or is it going to take some time after that to reach it? So, of course, everybody is watching it across the province from the standpoint of step 3. We're also, of course, watching it from the standpoint of the Delta variant, and we know it's still around. It's still out there. We've seen most recently in Waterloo what can happen when the Delta variant does start to spread more quickly, and we're very concerned that that it's still there, and that's something that could come down the line, particularly as we get back into the fall and winter months. So very important to continue to get those vaccination rates up.
Definitely. The second question, I just want to switch topics a little bit. You said that July 27th, I believe, was the last day that anyone in that 12 to 17 age group can get their first shot, to have the additional 2 weeks after their second shot by the time the school comes back. With that being tomorrow, right, today is the 26th, is there any last minute push to really encourage this age group to get vaccinated, as we're hearing more and more about schools reopening to a full degree?
Yeah, thanks, Emily. That's absolutely what we've been doing the last, over the weekend and at the end of last week, is talking about this, making sure people are aware of those timelines and what's needed. Absolutely getting the information out through as many routes again as we possibly can, and really hoping that people will come out. And of course, saying it's the ideal time. Please do come out as soon as you can, so that you're vaccinated by that deadline. But don't be deterred if it's the next day or the day after. That's still a great time to get vaccinated and come on out.
Great, thank you. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much. My first question is for Dr. Richardson, and follows up on, I think, the last question, is that, we are 1 day away from that deadline of when kids need a first dose to be fully protected before they go back to school. And 1 in 3 kids aged 12 to 17 have not had a first shot. So, what does that mean? How concerned are you about that for back to school? And what could that mean for back to school?
Thanks very much, Joanna. I think when it comes to getting back to school, what I'm most concerned with is that kids get back to school. We know that that's where they learn best. That's where they connect best with their teachers and their friends. That's where there's opportunities to have food programs, if that's the case. That's where there's opportunities to make connections, to do the things that they love to do, and to learn as best as they can. And so very much that's our first priority as we go forward. And you've heard that from our colleagues within the Children's Hospital, including McMaster Children's Hospital here in town, and from the science table as well. Now, in order to do that the most safely that they can, one of those critical ingredients that they need is vaccination. And so absolutely want to see those vaccination rates continue to rise in all of our youth 12 and over who are eligible for vaccination, as well as amongst the staff, the teachers. Of course, we don't track those rates directly, but we're concerned too for their health and well-being, of course, and want to see them vaccinated as well. So want to continue to see those rates go up, and people get vaccinated at the earliest opportunity they can, and get that second shot at the 28-day mark, if at all possible.
Thanks so much. My second question is also for you, Dr. Richardson. As early as August 6th, if we meet these immunization targets, we could be looking at a situation where there's almost no COVID restrictions at all. Do you think we're ready for that? Do you have any concerns about that? Like, what do you think about sort of the end of COVID restrictions?
Yeah, thanks, Joanna. It's been very interesting, of course, to look at what's happened around the world as we've gone through these phases. And I've been very pleased with Ontario's approach through this, with a cautious, stepwise, moving forward and seeing where we're at, checking in, seeing what's happening. And we've had, largely good news to date in terms of how things have gone. So as we go forward, I think we're all going to be looking at, well, it's not everything that is gone, but it is both, the factors of common sense. And you might have read from the science table things like hand washing, hygiene, staying home if you're sick, following good infection prevention and control measures. Those sorts of things need to stay in our practice and in our lexicon for good. Those are not going away. They must not go away. as we go forward. And, proof is in the pudding with last year's season when we followed that really well. We didn't see influenza, we didn't see other respiratory viruses, we didn't see big outbreaks of norovirus. Those sorts of things didn't happen either. And that's what is the true benefit from following all of those measures. So the question will be, are there other pieces that need to stay in place around things like school, and in order to do that safely? Are there things that we'll need to do depending on exactly the rate of COVID that we have? And of course, that's all still being discussed in terms of how we move forward. So you saw some inkling of that from the science table around schools in particular. You've seen our universities talking about the importance of vaccination before people are allowed to live in residence. And so all of those elements are going to continue to be critical for us to think through, adhere to as we go forward so we can stay safe.
Great, thank you, Dr. Richardson. Our next question is to Samantha Craigs from CBC Hamilton. Samantha, you can go ahead.
Thank you for taking my question. Again, to Dr. Richardson, who seems to be doing a lot of the answering. We're directing a lot of stuff there. What are you hearing in terms of why people aren't vaccinated yet?
That's a good question, Sam. It's a mix of things, I would say. There's some people who are just really concerned about the fact this is a new vaccine. It hasn't been out for that long. They may not know that it's gone through the same rigorous processes that every vaccine does through Health Canada and the review, and just how we're sharing all the information about the vaccines globally so we can make the best decisions, best recommendations that we have. And so certainly some people who either are quite worried about it and don't plan to get vaccinated for a long while, or just have been waiting to see how things go. And so there's one or two people who I've seen, say, okay, we've seen how it goes. Now let's get on with it. Let's get those vaccines in arms. Things are going well. The vaccines are performing very, very well, as we've all seen, with the rates dropping. The evidence of what happened in long-term care being the most critical one. There's then, of course, a group that aren't quite sure how it all works for them, and whether that's that they have some other medical issues or questions about how the vaccine works and they need some information. That's certainly something we've been seeing and hearing about as well. And so very much encouraging people to get information from great sources, credible sources. Their family doctor, of course, is a wonderful one for that. Our hotline, our website, other resources as well are critical too. And then, of course, there's people for whom it's just really hard to get vaccinated. They have other issues that they're paying a lot of attention to: how to put a house over their head, a roof over their head, I should say, how to look after their children, how to keep going to work and working very long hours, and may have some questions because of issues in the past that have led their community to feel that going to certain centers or vaccination isn't safe. And so for that group, it very much is building that trust over time and making vaccines as accessible as we possibly can so that they can get vaccinated. So a few different streams of reasons. It is a small number who truly just don't want to get vaccinated. And so we are going to continue to work with all the others to make vaccines and the information as available as possible and get those vaccination rates up over time.
Do you have any advice for how people can talk to friends and relatives who refuse to get vaccinated? How should they approach those conversations?
They're very important conversations, because we know that people close to others are a very good source of information for people. And so to, approach with curiosity, and caring, that's really critical. You must not approach with judgment or shaming or any of those sorts of things. Those just aren't going to take you in the wrong direction. I don't know about you, but if somebody approached me like that, I wouldn't be open for conversation and wanting to hear information. So that caring sort of, talking about how important the person is to you, that you're wondering how they're doing, whether they've been considering about this, what information do they need, how could you help, are there questions that you have? Those are all very important ways. I've certainly had that experience myself in working that through with people who are close to me and, who may or may not be very open to vaccination, and, had great success in that regard.
Thank you.
So we have a little bit more time, so we will go through for one more question each. We'll start back with Lisa Pileski. Lisa, if you'd like another question, you can go ahead.
Thanks very much. I'm okay. My follow-up questions were asked already.
Great, thank you. I'll go next to Desmond. Desmond, if you'd like another question, you can go ahead.
Thank you. Dr. Richardson, is there anything we can do individually and as a community to keep the Delta variant at bay?
Yeah, thanks, Desmond, for asking about that, both as a community and individually. You know, Paul has talked about a lot of the things that are critical as we're out there, that we all know that there's going to continue to be masking in place in certain indoor environments, and that there are some other rules that are in place that are there to protect people and to prevent the spread of it. And so continuing to follow those as we go forward. The pieces that I mentioned about things that should never change, the things about hand hygiene, about coughing into your sleeve, about not going to work when you're sick, about following all of those good measures are things that should never go away, that we need to continue to go forward with, whether it's about COVID-19 or whatever virus it is that we're speaking about. Those conversations that we just talked about too with people that are close to you about vaccination and caring about people and supporting one another in all of those means to protect one another are very important as we go forward. And different organizations looking at what's really the situation that they find themselves in, what kind of rules do they need to follow, what kind of policies do they need to put in place to support their staff to follow those kinds of preventive measures, as well as vaccination, are really important as well.
Great, thank you, Dr. Richardson. We'll go next to Emily Taylor from CHCH. Emily, if you'd like another question, you can go ahead.
Thank you. So we're not quite at the 2-week mark past the beginning of phase 3, but are there any new changes in cases or hospitalizations or any of our other metrics that would indicate that there's been a change with phase 3, or are we still seeing sort of the same trends from when things were shut down before?
Yeah, thanks, Emily. So far, we just kind of have a gentle fluctuation in case rates at a low rate. And so we're all watching very closely to see how they go and whether things change beyond that. But so far, just seeing a gentle fluctuation, nothing that's for sure at this point, and we'll keep watching.
Great, thank you. We'll go next to Joanna from the Hamilton Spectator. Joanna, if you'd like another question, you can go ahead.
Yes, thanks so much for the extra question. And my question's for Dr. Richardson. There has been a lot of, debate vaccine passports and what role they should play. So I was looking for you to weigh in on that, Dr. Richardson. What are your thoughts on vaccine passports in Ontario?
Yeah, thanks, Joanna. It's such a critical debate as we talk about vaccination passports, vaccination policies, and where they fit in this. And I think, we're seeing different organizations start to tackle those issues. As I mentioned earlier, the university is talking about how important vaccination is before coming into residence. And we have a number of universities, including McMaster here, Mohawk as well, deciding that vaccination, 2-dose vaccination is important before coming into residence. And so I think this is the piece, very supportive of ways to increase vaccination rates as we go forward. And then it's the debate about exactly which of those policies do we want to see. Long-term care homes, again, lots of success in terms of the policy being put in place around requiring vaccination, sharing that information, education if not vaccinated. And so I think there's some things that will help us to increase those rates. Exactly how far they go and is the question that we're all still looking at and debating as we go forward.
Great, thank you, Dr. Richardson. We'll go next to Samantha Craigs from CBC Hamilton. Samantha, if you'd like another question, you can go ahead.
Yeah, thank you. I always want another question. So thank you. This is either to Dr. Richardson or Paul Johnson. I think it's to Dr. Richardson. Has there been any discussion about putting vaccine requirements in place at the city, either for events or for staff?
I'm going to actually, Samantha, turn that one to Paul.
So at this time, there's no policy discussion about mandatory vaccine for city staff. Certain parts of our organization comply with provincial regulations, including our long-term care facility, which complies with that policy. But again, that policy is not mandatory vaccine. It's just a need for mandatory reporting on whether the individuals have received their vaccine or not. But we've found, for instance, in the long-term care facilities that this approach has really helped people to, again, think about it. Our rates have continued to go up and are over 90% in terms of our long-term care facilities. And so that is good news in terms of the process, really encouraging people to do where I think we are at the moment, which is really still asking people to consider very carefully about vaccines and get the information they need and take care of any of the concerns that they have so that they can make that choice on their own. But in terms of a policy discussion for the city, no. In terms of our facilities and our events that are sponsored by the city, no. We will comply with the regulations that are in place for our facilities and for our events at this stage, and really just continue to encourage people to get out there and get vaccinated, and we'll obviously, as all people will be, evaluate this as we go through the fall and see what may need to change. But at this stage, none of that is being contemplated.
Great, thank you. So that's the end of our media questions for today. So I will pass things back to you, Paul, for some closing remarks.
Well, thanks very much. And I want to thank Dr. Richardson for her update and for answering all of those questions today from the media. So thanks very much, Dr. Richardson, for that. And of course, I'd like to thank our media partners for joining us today, and then the team that brings us together. So Bill Custer, the Cable 14 team, and the folks at Clear Cable, allowing us to bring this type of update as we have for many months now in this format to folks here in Hamilton. We'll be back on August the 9th with our next update in this particular format. And in the meantime, from my perspective, and I think, you know, this echoes comments that Dr. Richardson would make, and both working alongside the mayor for as long as I have, I'm sure the mayor would concur that, you know, let's continue to enjoy the chance to see family and friends, something that has been in short supply at times during this pandemic. Let's continue to enjoy the activities that bring us joy, and keep a positive energy about where we are and where we're going. And at the same time, let's continue to get vaccinated. Let's respect the rules that are in place. And let's continue to live, work, play, and learn in as safe a way as possible. If we do that, not only today, but tomorrow and the coming months will be very bright for this community. So thanks very much. We'll see everybody on August 9th, and appreciate everybody's attendance today.
30 seconds.